The truth about your arches that the pros aren't telling you about. My name is Dr. Nick from Preferred Physical Therapy, where we help people 40 plus stay active and independent, live free from painkillers, and avoid surgery. I'm going to talk all about the arch of your foot, why it's important, and why so many people will suggest arch supports when that's really not what you need. In this video, we're going to deep dive into why the arch of the foot is so important and why so many people, so many professionals will get hung up on whether or not your low arches are causing the problem or whether your high arches are causing the problem, because it's so widely misunderstood and so often overprescribed using either foot orthotics or arch supports in your shoe. Real quick, a brief anatomy lesson of the foot. What you'll notice, this is the left foot, left leg. We have the heel in the back. These are all the toes in the front. This is the inside of the foot. So this is where the inside arch. This is the arch most commonly talked about, most commonly irritated and treated. We have two other arches. We have one that goes right underneath, and then we have one on the outside. These are often overlooked, kind of ignored, no big deal. So we're going to talk a lot about this one down the middle because it's commonly associated with heel pain, plantar fasciitis, bone spurring of the heel. We get a lot of talk about why arch support can help protect or mitigate from developing those conditions. What's also important to remember is that the arch, give it passive structures that give it support and active structures that give it support. Active structures are muscles. Passive structures are bones and ligaments and fascia. Plantar fascia is the primary passive support of the arch. We also have a long ligament that helps out. Because they're so rigid, we don't have a whole lot of play with how to stretch or mobilize those things, particularly in a tight or rigid foot structure, often seen in high arches. So what happens is people with low arch, we feel like needs to be supported, needs to be treated. When the reality is that low arch is just more mobility, it's more movement in the arch. It doesn't mean it's a problem. All we get worried about is it can become a problem if the muscles, the active stabilizers, aren't producing the arch. And that's what we rely on, those of us, myself included, who have low arches, a more of a loose foot arrangement. So as we land, the way this works, as we load the foot, we'll see this arch drop or flatten. The easiest way to tell if you have a flat foot or low arch is if you get your feet wet and walk on concrete and see how much of the sole of your foot is printed on the concrete. If you see a wide footprint where it's every surface of your skin on the bottom of your foot is making contact with the ground, that means you have a flat foot. If you see kind of this 7 shape where you see the balls of your feet, a little bit of the side of your foot, and then your heel, that's a fairly normal or typical arch situation. If you only see the balls of your feet and your heel, that's an extremely high arch or rigid foot structure. Both of these environments, a flat foot and a high arch, predispose you to different conditions. We see a lot of high arch individuals run into issues with plantar fasciitis and Achilles tendonitis, sometimes even metatarsalgia pain, which is pain across the balls of their feet. Low arch situations, we can have navicular bone irritation because of how often that navicular bone, which is this bone right here, where the posterior tib muscle will run back behind the ankle and up, and that's the active support system for the arch. If that's weak and we have low arches, then this navicular bone is going to land on the ground and get irritated every time we step. If we're very active, we're a runner, we often will see that as overpronation or too much pronation that can be problematic, where we get this ache and pain on the inside of our foot because of so much contact through the ground or our shoe over that navicular bone. That can cause irritation, that can cause bone spurring, that can even cause a posterior tib tendon rupture. We see that sometimes. So both situations, whether you're high arch or low arch, predispose you to problems. So the solution for many folks is to support the arch. As physical therapists, we have a hard time with supporting the arch under normal, healthy, active individuals, is because any architect will tell you the minute you support the arch from underneath, you actually weaken the arch structure, meaning that we don't want to push a rigid support up under the arch to give it support. Instead, what we want to do is we want to mobilize the arch if it's tight, and we want to strengthen the arch supporters if it's weak. If you have a tight and rigid foot structure, you have a high arch situation, we want to mobilize it. If we have a low arch situation and weakness, we want to strengthen it. I'm going to give you an exercise to strengthen, and then one technique you can use to mobilize your high arch situation. So ditch those arch supports and try this instead. Okay, so this exercise is a technique to help strengthen the arch or the bottom of your foot. And again, this is perfect for all of you folks who have flatter feet. A real easy way to test. Not only is it by wetting your feet and walking on concrete, you can also lay your foot sitting here, take your shoes and socks off, Put your foot on the floor, pull your toes up. As you pull your toes up, if you see this arch up here, and if you let your toes down and it flattens all the way out, you have a flat, mobile foot. Not a bad thing, just you have a flat, more mobile foot. If you're sitting here, your arch is already high, you pull your toes up and you don't see a difference between when your toes are up or when your toes are flat, you have a high arch or a rigid foot situation. You have a high arch or a rigid foot. So if you have a flat, flexible foot, this is the exercise for you. You're gonna start seated, bring your feet in underneath you a little bit so there's a little bit of bend in the ankle. And you're gonna push your toes down, and then you're gonna push your ankle over top of your fourth and fifth toe, which is your pinky toe. So instead of coming up over top of your big toe, you're gonna come up over top of your fourth and fifth. Essentially, you're gonna push your toes to the inside of your ankle. This can seem very simple, very easy, and if it is, then we just progress it very quickly by putting a ball between your heels, squeeze your heels together, and then calf raise. You can also do it with a band around your ankles, kind of around the middle foot actually. It's not quite around the ankles, it's more around the middle foot, both together, and you're gonna push out into the band as you go up onto your toes. This is strengthening the posterior tibialis muscle, which is the one that comes down and inserts onto the navicular bone, which helps to lift and elevate your arches. This is an active support for your arches so that as you do walk, run, so we have more support for those flexible feet. You're gonna dose this from a higher rep standpoint and then add load. So seated like this, you're gonna do 2 sets of 15 to 20 reps. Keep it fairly high. As that gets easier, go into standing, and then you wanna lower the load, going from 2 to 3 sets of 8 to 15 reps. So for you high archers, for you folks who have rigid feet, the exercise that I really like to work on is mobilizing the entire length of that plantar surface. So everything from balls of the feet all the way back to heel. And the best way to do that is we want to pull from the angles of our toes and our ankle. So I like to get a hand towel. This is a simple hand towel from the kitchen or bathroom. You roll it up about halfway up. We want to get it enough to where we have our toe elevated versus the balls of our feet. And then we're going to get down onto one knee. We're going to stretch over top while that toe is elevated, and then we can calf raise up from there. This just helps increase mobility all along the bottom of the foot, particularly as this ankle, we call this dorsiflexion, and the balls of our feet are up. We're going to come from there and just mobilize and stretch. You'll feel a big lengthening of our soleus, so the muscles in the back of our leg, as well as all along the bottom of our feet. You're going to do this a little bit less because we're going to do a few holds. So here we're going to hold, feeling a bit of a stretch in the backside of our ankle, 5 to 10 seconds. Go up all the way, hold 3 to 5 seconds, and then back down 5 to 10. The reason why we hold less across our toes are a little more delicate. There's no need to put a whole lot of strain or load across them. So 3 to 5 at the top, and then 5 to 10 at the bottom, doing that 10 times. One of the truths about high arches and low arches is that in both situations, you need strength and you need mobility. So even if you have a high arch, it doesn't mean you have all the muscle strength or muscle activation that you need to support that arch. Oftentimes, people with high arches will get foot pain because of weakness, and it's the rigidity of their foot that's contributing or causing that pain, and it's there because they don't have the muscular support to help offload the passive support, the rigid structures of the foot. So yes, if you have high arches, you also will need to strengthen. Your low arch folks, your flexible feet folks, that doesn't mean you don't need to do any mobility or flexibility work for your foot. Oftentimes, they can be strong enough, but those muscles need to be stretched or need to be mobilized. And so it's still appropriate for them to do some of our flexibility work because that will help calm down or soothe some of those aching muscles that are having to do too much when the passive structures of the foot aren't supportive. So in both situations, you need each other, and that's where so often we see an overprescription of arch supports to try and combat both of those situations at the same time, when the reality is understanding what the root cause is and then diagnosing and dosing a treatment is most effective. Being told you need orthotics or arch supports isn't the complete solution. In fact, it's often just a Band-Aid to make it very easy for you to ignore what you really need to do. ultimately identifying whether or not you need flexibility or you need strengthening for specific muscles of the foot, which are easy to do on your own. So do you have flat feet or high arches? Let me know in the comments below.